Just talk to us about the warnings you've made and why you're doing so at this time.
Thank you. We have had a 25% erosion in our pay, but our big focus on today are those nurses that are at the lower end of the nursing pay scale. That's where we want real reform, because nurses within Agenda for Change, which is the NHS pay scale, are weighted to the bottom of that scale. And we want to make sure that nurses both come into the NHS and social care sector, and we believe reforming pay at the lower parts of the scale is what we want to see happen.
And I'm correct in thinking, am I, that the current offer to NHS staff is 2.8%?
We haven't been told what the pay offer will currently be. That hasn't been confirmed. We're waiting for the pay review body to confirm what the pay offer will be. But what we do know is there is a significant shortage of nurses in the UK, both in the NHS and in the care sector. And we do not have enough people coming into nursing, even though it's an amazing career. We're not attracting young people in. And we believe that pay and conditions have got to change in order to recruit people into nursing.
You're quoting a figure of a 25% erosion over the course of 15 years. It then surely poses the question, are you looking for a full 25% pay rise? Or are you looking for that over a period of years? What's your ideal objective here?
What we want is structural change that starts to both address pay and progression for nursing. The Health Secretary knows that's what we're looking for, because nurses at the moment are weighted to that bottom of the scale. We do not have the same terms and conditions as paramedics and midwives, and we believe that we need that for nursing, and that should be the start of clawing back that pay erosion.
The Health Secretary is also facing calls from the BMA and junior doctors to increase pay there. He's talked about unaffordability. He'll surely point to the government's fiscal rules and the Chancellor, Rachel Reeves, and the pressures on the economy. If he proves to be stubborn, from your perspective, in increasing wages in the direction that you're looking for, are you prepared to strike?
What we want is to work with this government. The last thing the public needs and the profession needs is more strikes. But there comes a point where nursing needs investment in this country. And I totally understand the affordability arguments. But from the patients and the public, they can see it. We cannot afford not to invest in nursing. And you know, nursing is the cornerstone of every single healthcare system. And we absolutely need to value it. That's what we're looking for. We totally understand the financial concerns, but with the pressures on care, in both hospitals, community, GP practices, everywhere, patients know that nursing needs investment. And actually, this government needs a political win as well as doing the right thing for patients. So we know if they focus on nursing, they will be doing the right thing by the public as well.
It's previously been said that the RCM was looking for a constructive dialogue with ministers. Have you been able to have that so far?
We've had very constructive dialogue. We know that this government is committed to the NHS, and we know that they are listening. But there comes a point when we've got to have more than listening, and that's what we're looking for today. I'm here with nearly 3,000 nurses today, and they want to see this government not just give them tea and sympathy. They want to start seeing that they will properly invest in nursing in this country, and that requires brave decisions and action.
You say there comes a point. From your perspective, when is that point? Is that the end of this week? Is that in a month's time, 3 months' time? At what point do you get to the end of your metaphorical tether and say, right, it's time to pursue the action that you've admitted you would rather not do, but you are prepared to? So
the government's got some very key milestones this summer, including the 10-year NHS plan, the workforce plan, big budget decisions. There are some very, very key moments this summer that this government can use to sort things out. There's been all this discussion in the past 24 hours about immigration. We are totally reliant on our brilliant colleagues from around the world. But what's the government's domestic plan for and strengthening nursing in the UK. They cannot afford not to take action this summer. So I very much hope that we have constructive dialogue. The last thing our profession needs and patient needs is more strike action. But nurses primarily are concerned about themselves, but their real concern is the people they're looking after.